Some of you might not like this. I've said it before. There was one thing that I was wrong on. Donald Trump is way worse than Hillary Clinton on the environment. Hillary Clinton was bad herself, but I don't think she would have appointed this idiot, dangerous man named Scott Pruitt to be EPA chief. I mean, he's rolled back clean air emission rules, clean car rules, clean water rules, clean everything. He's not interested. Scott Pruitt has met with more fossil fuel executives and business executives than actual environmental activists. Way more. But this is a new level, what he's doing now. It's totally new level. And let's press the share button. Let's get this out to more people. Scott Pruitt, I don't even, I wish I was making this up. Scott Pruitt wants to change how science is used for EPA regulations. And let me tell you something, as somebody who's been working on a piece about cooked up science, the science currently is already very questionable. Scott Pruitt, he wants to make it 10 times worse. You ready? In a move that could fundamentally reshape the way science supports environmental regulation, EPA Administrator Scott Pruitt announced Tuesday he wants the agency to rely on the studies that are fully transparent. Oh boy. Quote, "The era of secret science at EPA is coming to an end," Pruitt said. "The ability to test, authenticate, and reproduce scientific findings is vital for the integrity of rulemaking process. Americans deserve to assess the legitimacy of the science underpinning EPA decisions that may impact their lives." Okay, sounds wonderful so far. The proposal was immediately announced by environmental activists, public health advocates, and Democratic lawmakers as a cynical and dangerous maneuver to slash long-established public health protections because much of the data behind anti-pollution rules are individual health records that are privately protected. So basically, in English, what Scott Pruitt is trying to do, he's trying to make studies that are largely based on private health information banned. So a lot of studies are based on, data and research of sick people in places, or the effects of, air pollution or water pollution or whatever it is. And as this article states right here, the move is a dangerous maneuver to slash long-established public health protections because much of the data behind anti-pollution rules are individual health records that are privately protected. In Scott Pruitt's world, that's not being transparent, so he wants to get rid of it. Pruitt has earned the unabashed scorn of environmentalists and public health advocacy groups and praise from industry for the aggressive manner in which he is trying to undo a number of Obama-era regulations addressing water quality, clean air, and climate change. But the move to address secret science may be the most ambitious because of its potential scope. Limit the science that could be used as legal justification behind regulations, and you limit the regulations that can be approved. That right there, folks, is the intent. He's trying to limit the amount of regulations that can be approved. In announcing the proposed rule, the EPA said the change would also address the, quote, replication crisis, where a significant proportion of published research would be not deemed viable because it can't be reproduced. That would mean long-term studies that, for example, follow the health of the children of poor women living in heavily polluted communities over decades could not be used in EPA rulemaking because replicating the research would be prohibitively expensive and cost lives by wasting valuable time. This is one of the more dangerous parts of the whole thing. Part of science is peer review. Part of science is if one person does a study, replicating it on the other end. So, there's human error and scientists aren't always right. And sometimes they do testing that's wrong or, was imperfect in some areas. So you want to replicate, other scientists and other researchers want to replicate it. According to Scott Pruitt, there's a replication crisis. Basically, Scott Pruitt he's trying to claim that he's doing this for more transparency so there's not like secret data being used for regulations. Well, most of the secret data is people's private health information. And there is no replication crisis. If anything, there's not enough studies being done to confirm other scientists' study.